Good morning, ma'am. I am your nurse for today. I am Altreba Nagtang and I will be performing the assessment of the ears. May I know your name?
Phoebe Orcala.
Okay. I will now wash my hands to prevent spread of microorganisms. And I will gather the materials such as a tuning fork, an otoscope, and a wristwatch with a second hand. So this assessment will focus only onto the internal and external structures of your ears, including the assessments of the sense of hearing. For the external structures of the ear, inspect for the auricles and tragus and lobules, for the size and shape, the position and lesions for any discoloration and discharge. You can palpate for the auricles and the mastoid process for any presence of tenderness. Ask the client to sit comfortably with the back straight and the head tilted slightly away from you and toward his or her opposite shoulder. Choose the largest speculum that fits comfortably into the client's ear canal and attach it into the otoscope. Holding the instrument in your dominant hand, turn the light on the otoscope to on. Use the thumb and the fingers on your opposite hand to grasp the client's auricle. Firmly but gently pull out, up, and back to straighten the external auditory canal. Grasp the handle of the otoscope between your thumb and your finger and hold the instrument up and down. Position the hand holding the otoscope against the client's head or face. This position prevents forceful insertion of the instrument and helps to steady your hand through the examination, which is especially helpful if the client makes any unexpected movement. To perform the whisper test, by asking the client to gently occlude their ear not being tested and rub the tragus with a finger in a circular motion. Start with testing the better hearing ear and then the poorer one. With your head 2 feet behind the client, whisper a 2-syllable word. Popcorn.
Popcorn.
Football.
Football.
Test for the other one.
Runner.
Jumper.
Jumper.
To perform the Weber's test, strike the tuning fork at the back of your hand and place it at the center of the patient's head. It is important that you place the tuning fork into the center so that the patient would be able to identify which sound reaches the ears. Ma'am, did you hear the vibration on both of the ears?
Yes, sir.
To perform the Rene's test, all you need to do is to strike the tuning fork at the back of your head and put it into the mastoid process of your patient. Instruct the patient to tell you if the vibration can no longer be heard and put it into this position. To perform the Romberg tests, ask the patient to keep the feet together and the arms at her side and close her eyes for 20 seconds and observe for saying. To prevent injury, you may also stand at the side of the patient so you could catch them if they are about to fall.